Family mode.
This webinar is designed to show system administrators how to set up and configure National Enrolment Services in Medtech Evolution. Prior to doing this, you need to ensure that you've contacted the Ministry of Health to get access to both NHI and NES services for your organisation. They will provide you your login credentials. You then need to ensure that you are on Medtech Evolution version 1.5.6 at a minimum. To start with, you need to check that your HPI organisation number is in place. To access this, click File, Options, Location, Location Settings, select your location, and under the Codes and Defaults tab you will see your HPI organisation ID. There is a new setup menu called Connected Health Information Services accessed here. To start the configuration and setup, click on NES Setup. Within this screen, you will see the username and password where you need to enter your login credentials provided by the Ministry of Health. In the Staff Setup tab, you can choose to allocate permissions and level of access for each staff member for both identity services and enrolment services. To allocate permission and access, simply check the tick boxes for each person under each heading. Once you've completed this, click OK. The last stage in setting up your environment for the National Enrolment Services is to run the bulk enrolment utility. The NES bulk enrolment utility is used to automatically enrol patients that have been registered and updated in the outage period. The outage period is the period between the last PHO export date and time and the current date and time. To access this utility, click on File, Options, Connected Health Information Services, and NES Bulk Enrolment Utility. If the last PHO export date time is not already populated, please enter it and click on the Find Patient button. This warning message will pop up. To continue the bulk enrolment process, click Yes, otherwise click No to close the utility. In this instance, we'll click Yes. This utility will populate the list of patients to be enrolled or updated in the NES Bulk Enrolment tab, shown here. It will load the following list of patients to be enrolled: new patients registered during the outage period, and patients whose patient register details have been updated in the outage period. It's important to note that even though all patients with updated patient register details are loaded, update enrolment action will be taken only for those patients who have registered provider or enrolment confirmation dates were updated. No action will be taken for the rest of the patients. You will identify the action that is proposed in this column here. Once you have confirmed the actions are appropriate, click on the Enroll Patient Update Enrolment button, and once the process is complete, the status will be updated in the Action Taken column. The NES Bulk Enrolment History tab will populate the list of patients who were actioned previously. The utility will process 500 records at a time. Once 500 records are processed, the utility must be rerun to the rest of the patient's records. The history of all the records processed each time can be viewed by clicking the Date Time button on the side here. Once you have finished, you can close the screen, and that is how you set up and configure your practice for National Enrolment Services in Medtech Evolution.